You guys asked for it, so here it is. A common question that I get in my DMs is, Dr. Hassan, I'm having so-and-so surgery. What kind of risks are there? Now, while it's hard and I try to answer everybody who asks me questions, it's hard to kind of assess an individual situation without knowing you personally or seeing you as a patient. But what I can tell you is a common question you're going to get asked and a common method to determine what kind of risk stratification you have for surgery is an anesthesiologist will at some point ask you, Mr. So-and-so, Mr. Smith, Mrs. Smith, are you able to walk up 2 flights of stairs? Or are you able to walk 2 city blocks? Now, what they're really asking you is what your metabolic equivalent task score is, also short form METs. And what this question does is it helps us delineate how risky you are for the surgery. Now, I want to break it down for y'all. The way it's done, during a surgery, your body still feels pain and your heart still feels stress. However, your brain does not process it. Now, what this means is that during surgery, you go through a mini little stress test, or it can be a max stress test. But what we use to risk gauge to see if you are capable of having surgery without having an adverse reaction is a MET score. And so if you are able to walk up 2 flights of stairs without getting short of breath, or you can walk 2 city blocks without getting short of breath continuously, then that means you're probably in pretty good shape to have surgery. Now, obviously, there's a lot of people that can't do this, and there's a lot of mitigation factors that we do during anesthesia to keep everything normal tensive and normal stasis. However, this is the question that we typically ask to help gauge whether or not you're going to do very well in anesthesia. And not only anesthesia, during the surgery. Now, there are a lot of caveats to this. There's a lot of different types of surgeries that cause more and less stress on the body. The type of surgery, the location of surgery, the amount of instrumentation, all these different things affect your heart, and they affect how much stress your body goes under. But a simple gauge on where to start before you have surgery, if you want to know if you're a good candidate, if you're going to do fine, if you want to give yourself some reassurance, can you walk up 2 flights of stairs without getting short of breath? If you can do that, if you can walk 2 city blocks, which most people don't live in cities, so it's a useless question. But if you can walk up 2 flights of stairs, you don't get short of breath, you're probably in pretty good shape to have surgery. Now, everybody's case is individual. It's always not real medical advice until you ask a physician in person. However, this is just some knowledge to put your mind at ease if you're having surgery. I can answer more specifics in my comments and DMs, but this is a little bit of guideline, a little bit of common knowledge I wanted to share. If you like it, please like and subscribe for more.